Good morning, guys. Okay, so we're going to be starting on chapter 12, the cardiopulmonary procedures on page 456. So we'll start with the introduction of the electrocardiography. The electrocardiograph is an instrument used to record the electrical activity of the heart. The electrocardiogram ECG is a graphic representation of this activity that needs to be highlighted. The ECG exhibits the amount of electricity activity produced by the heart and the time required for the pulse to travel through the heart. Cardiovascular disorders can cause abnormal changes to occur on the ECG. Because of this, electrocardiography is used for the following purposes. All of these need to be highlighted. To evaluate the following symptoms: chest pain, shortness of breath, dizziness, or heart palpitations. To detect an abnormality in the heart's rate or rhythm, which is also known as dysrhythmia. To detect the presence of impaired blood flow to the heart muscle, known as a myocardial ischemia. The term ischemia refers to the deficiency of blood in the part of body usually caused by a blocked artery. To help diagnose damage to the heart caused by a myocardial infarction. To determine the presence of hypertrophy, enlargement of the heart. To detect inflammation of the heart muscle, myocarditis, or the lining of the heart, pericarditis. To assess the effect of the heart of digitals and other cardiac drugs. To determine the presence of electrolyte disturbances. To assess the progress of rheumatic fever. To detect congenital heart defects. Performed before surgery to assess cardiac risk during surgery and as part of a complete physical examination. All of that needs to be highlighted. If we go under the structure of the heart on the other side on page 456, the human heart consists of 4 chambers. The right and left atrial are the small upper chambers of the heart, and the right and left ventricles are the larger lower chambers. Blood enters the right atrium from 2 large veins, the superior vena cava and the inferior vena cava. That needs to be highlighted, which bring it back from its circulation through the body. The blood entering the right atrium is deoxygenated. That needs to be highlighted, meaning it contains very little oxygen and is high in carbon dioxide. From the right atrium, the blood enters the right ventricle. It is pumped from here to the lungs by the way of pulmonary artery. The blood picks up oxygen in the lungs in exchange for carbon dioxide and returns it to the left atrium of the heart through the pulmonary veins. From the left atrium, the blood enters the left ventricle. This is the most muscular and powerful chamber of the heart and pumps blood to the entire body. Blood exits from the left ventricle through the aorta, which distributes it to all the parts of the body to nourish the tissues with oxygen and nutrients. That needs to be highlighted. If we go on over to page 457, the conduction system of the heart. The sinoatrial SA node is located in the upper portion of the right atrium, just below the opening of the superior vena cava. It consists of a knot of modified myocardial cells, that needs to be highlighted, that have the ability to send out an electrical impulse without an external nerve stimulus. In this way, the SA node initiates and regulates the heartbeat and is often referred to as the pacemaker of the heart. That needs to be highlighted. If we go on down to the next paragraph, you need to highlight where it says the impulse is picked up by an atrial ventricle AV node, another knot of modified myocardial cells located at the base of the right atrium. The AV node delays the impulse momentarily to allow for complete contraction of the atria and filling of the ventricles with blood from the atria. That needs to be highlighted. If we go down a little further, highlight where it says the Purkinje fibers distribute the impulse evenly to the right and left ventricles. That needs to be highlighted. If we go on over to page 458 under the cardiac cycle, highlight where it says the cardiac cycle represents one complete heartbeat. If you go over to the waves, please highlight and study the P wave, the QRS complex, the T wave, and the U wave. On page 459 for the baseline segments and intervals, highlight the sentence where it says the flat horizontal line that separates the various waves is known as the baseline. If we go on over to the other side on page 459 in that very last part of that first paragraph, highlight where it says a segment is a portion of the ECG between two waves, and an interval is a length of one or more waves in a segment. Highlight segments for the PR segment, the ST segment, and the intervals, PR interval, QT interval, baseline. Those need to be highlighted and studied as well. On page 460, if we go on over to the electrocardiograph paper, highlight the sentence where it says each small square is 1 millimeter high and 1 millimeter wide. Each large square, made up of 25 small squares, is 5 millimeters high and 5 millimeters wide. That needs to be highlighted. If you go down to the last sentence of that paragraph, highlight where it says a myocardial infarction can cause a larger than normal Q wave and an elevated ST segment. And then if you will highlight on the other side for the figure 12.7 where it says a normal standardization mark is 10 millimeters high, that needs to be highlighted. If we go to page 461 under the electrocardiograph leads, the standard ECG consists of 12 leads. A lead is a tracing of electrical activity of the heart between two electrodes. Each lead provides an electrical photograph. That needs to be highlighted. The next paragraph, highlight where it says there are 4 limb lead wires, the right arm lead wire, the left arm lead wire, the right leg lead wire, and the left leg lead wire. The right leg lead wire is known as the ground. All of that needs to be highlighted. There are 6 chest lead wires. Each is abbreviation with a V and includes V1, V2, V3, V4, V5, and V6. That needs to be highlighted. For the electrodes, the electrical impulses given off by the heart are picked up by electrodes and conducted into the machine through lead wires. Electrodes are composed of the substance that is a good conductor of electricity. That needs to be highlighted as well. If you go down to the very last sentence of that paragraph, highlight where it says the amplified voltages are changed into mechanical motion by the galvanometer and recorded on the electrocardiograph paper by a thermal point head. That needs to be highlighted. If you look on figure 12.8, you actually can see exactly how you would set up all the leads. This is something that we will go over in clinic, but this is a good study guide. All right, if we go on over to page 462, you need to highlight where it says an electrolyte is a substance that facilitates the transmission of the heart's electrical impulse. If you go down a few sentences, highlight where it says the electrode is applied to the skin and held in place with its adhesive backing. If we go down 2 more paragraphs, highlight where it says the medical assistant must always check the expiration date of the electrodes before applying them. The electrolyte gel on the outdated electrodes may be dried out. A dried out electrolyte is unable to transmit a good ECG signal. Also continue highlighting on the other side on page 462 where it says electrodes are sensitive to environmental conditions and must be stored properly to prevent electrolyte drying. Also highlight where it says when electrode pouch is open, the medical assistant should seal the pouch by folding over an end of it and then place the pouch containing the remaining electrode cards in a zipper lock plastic bag to preserve moisture. That needs to be highlighted. For the bipolar leads, I need you to highlight where it says that the first 3 leads of the 12 lead ECG are the bipolar leads. They are the leads 1, 2, and 3. The bipolar leads are 2 of the limb electrodes to record the heart's electrical activity. Highlight where it says lead 1 records the electric current traveling between the right arm and the left arm. Lead 2 records the electric current traveling between the right arm and the left leg. And lead 3 records the electric current traveling between the left arm and the left leg. Augmented leads. The next 3 leads are the augmented leads. AVR, augmented voltage right arm, AVL, augmented voltage left arm, and AVF, augmented voltage left leg or foot. That needs to be highlighted. At the very last part of that same paragraph, you need to highlight that the leads 1, 2, 3, AVR, AVL, and AVF provide an electrical photograph of the heart's activity from side to side and from top to bottom of the heart. For the chest leads, the last 6 leads are the chest or precordial leads, V1, V2, V3, V4, V5, and V6. These leads record the heart's voltage from front to back. Make sure you become familiar with the figure 12.10 on page 463 and figure 12.11. If we go on over to page 464, you need to highlight that under the paper speed, normally the ECG is recorded with the paper moving at a speed of 25 milliliters per second. Now if we go on over to page 465 under patient preparation. Minimal preparation is required for an ECG. The medical assistant should instruct the patient in the following guidelines, which facilitate placement of the electrodes and ensure good adhesion of the electrodes to the patient's skin. Highlight number 1, 2, and 3. Number 1, do not apply body lotion, oil, or powder on the day of the test. This may make it more difficult to apply the electrodes. Number 2, wear comfortable clothing and a shirt or blouse that can be removed easily. And then number 3, women should not wear full-length hosiery such as pantyhose or tights. All right, now we're going to go on over to page 468. That very first, I guess it's going to be the second sentence highlight where it says there are known as artifacts and represent additional electrical activity that is picked up by the electrocardiograph. You need to highlight under the muscle artifact, highlight that a muscle artifact can be identified by its fuzzy, irregular baseline, and you need to highlight number 1, 2, 3, and 4. For the wandering baseline artifact, it can be caused by the following. Highlight number 1, 2, 3, and 4 on that as well. For the 60 cycle interference artifact, AC artifact is caused by electrical interference. That needs to be highlighted. On the last part of that paragraph, highlight where it says, this type of artifact appears as small, straight, spiked lines that are consistent. Highlight number 1. I need you to highlight on page 469 A, B, C, and D. If we go on over to page 470 under the procedure 12.1, please highlight number 3, 4, and 5, number 8 and 10 on page 471. And then if we go on over to page 473 under the Holter monitor electrocardiography, a Holter monitor is a portable ambulatory monitoring system for the continuous recording of the electrical activity of the heart for 24 hours or longer. That needs to be highlighted. If we go under the purpose, a Holter monitor electrocardiography is an important non-invasive procedure used to diagnose cardiac rate, rhythm, and conduction abnormalities. Specifically, is most frequently used for the following purposes: to assess the rate and rhythm of the heart during daily activities, to evaluate patients with unexplained chest pain, dizziness, or syncope, fainting, to discover intermittent cardiac dysrhythmias not picked up by a routine resting 12-lead ECG. A resting ECG records only 40 to 50 heartbeats, whereas a Holter monitor records approximately 100,000 heartbeats in a 24-hour period. You guys will notice that I'm doing ECG. Some refer to it as an EKG, so you may kind of refer to it, but right now I'm going to say it as it is written in the book. A resting, I'm sorry, I already did that one. To detect myocardial ischemia, to assess the effectiveness of any antidysrhythmic medications, such as digitalis anti-anginal medications, and to assess the effectiveness of a pacemaker. Those things need to be highlighted. For the digital Holter monitor, I need you to highlight where it says most providers order a 24-hour recording, but they may occasionally order a 48 or 72-hour recording when the heart's activity needs to be recorded for a longer period of time. If we go on over to page 474, I need you to highlight number 1 under patient preparation. For the patient diary on the other side on page 474, where it says figure 12.17, all activities and emotional states must be documented during the monitoring period along with the time of their occurrence. That needs to be highlighted. If we look on page 475 on the Holter monitor patient guidelines, I need you to highlight number 1, 2, and 4, number 9, and number 10. Okay, now we're going to go on over to page 480. For the cardiac dysrhythmias, please highlight where it says the term normal sinus rhythm refers that an ECG that is within normal limits. For cardiac dysrhythmia, it's the term that used to describe abnormal electrical activity in the heart causing an irregular heartbeat. Also highlight 1 extra beats, 2 an abnormal rhythm, or 3 an abnormal heart rate. If we go on down to the PSVT, paroxysmal supraventricular tachycardia, PSVT is an absurd episode of tachycardia with a constant heart rate that usually falls between 150 and 250 beats per minute. PSVT is characterized by a rhythm that has a sudden onset and termination. That needs to be highlighted. Also highlight where it says with PSVT, the patient experiences a sudden pounding or fluttering of the chest associated with weakness, breathlessness, and acute apprehension. For a premature atrial contraction, or PAC, please highlight that it's characterized by a beat that comes before the next normal beat is due. For clinical significance, highlight where it says premature atrial contractions are common in healthy individuals and are often associated with the intake of stimulants, such as caffeine and tobacco. Highlight for the atrial flutter that an atrial flutter is a rapid, regular fluttering of the atrium. If we go on over to page 482, highlight under clinical significance that an atrial flutter rarely occurs in healthy individuals. It is found in patients with an underlying heart disease. That needs to be highlighted. You do need to become familiar with atrial fibrillation, with premature ventricle contraction, and the clinical significance. And I actually want you to become familiar with the clinical significance also of the atrial fibrillation. For the ventricle tachycardia on 43, highlight where it says a ventricle tachycardia consists of series of 3 or more consecutive premature ventricle contractions. That needs to be highlighted. We're going to go down to the ventricle fibrillation, also known as VFib. It's the most serious dysrhythmia. That needs to be highlighted. Also highlight where it says because of this, virtually no blood is injected into the systemic circulation. On page 484, highlight under the clinical significance that the most common cause of ventricle fibrillation is an acute myocardial infarction. For pulmonary function test, also known as PFT, highlight where it says it's to assess lung functioning, assisting in the detection and evaluation of pulmonary disease. Pulmonary function tests include the spirometry, lung volumes, diffuse capacity, atrial blood gas studies, pulse oximetry, and cardiopulmonary exercise test. If we go down to the spirometry, it is a simple, non-invasive screening test that is often performed in the medical office. A computerized electronic instrument known as a spirometer is used to conduct the test. The spirometer measures how much air pushed out of the lungs and how fast it is pushed out. Sorry guys, my dog is moving on the bed and it's moving the webcam. All right, you need to highlight where it says the indications for performing the spirometry include 1, 2, 3, and 4. That needs to be highlighted. I also want you to highlight for the VFC, which is the maximum forced vital capacity, is the maximum volume of air measured in liters. This can be expired when the patient exhales as forcibly and rapidly as possible and as long as possible. You need to highlight, if we go on over to page 485, under the evaluation of the results, you do need to highlight that the demographic factors are used to calculate the predicted values, which is what the results should be for a patient with healthy lungs. On page 486, you need to highlight number 1, 2, 3, and 4 for the patient preparation. You also need to highlight under the calibration of the spirometer. To ensure accurate and valid test results, the spirometer should be calibrated each day. Okay, on page 489 for the peak flow measurement under asthma, you need to highlight that asthma is a chronic lung disease. On the other side on page 489, I need you to highlight that asthma affects the smaller bronchi and the bronchioles of the lungs. Asthma can occur at any age, but is more common in children and young adults. On page 490, I need you to highlight that asthma is characterized by chronic inflammation of the small airways of the lungs and recurrent attacks of coughing, chest tightness, shortness of breath, and wheezing. If we go on down to asthma attack, on the third paragraph, I need you to highlight the examples of common allergens that may trigger an asthma attack. Include house dust, pollens, molds, animal danders, and cockroaches. Asthma attacks can also be triggered by environmental irritants, activities, or events, including air pollutants, tobacco, smoke, chemical fumes, vigorous physical exercise, upper respiratory viral infections, exposure to cold, and emotional stress. You also need to highlight that on the other side on page 490, sorry guys, I got big dogs and they're on my bed. Highlight where it says, during a severe asthma attack, the bronchial tubes continue to constrict and swell and become clogged with mucus. Okay, if we go on over to page 491, I need you to highlight that quick relief medication, also known as rescue medication, opens the airways quickly by dilating the bronchial tubes. Under peak flow meter, on the second paragraph, I need you to highlight that first sentence. A peak flow meter is used to measure how quickly air flows out of the lungs when the patient exhales forcefully. On page 492, under figure 12.25, highlight that the low range meter has a range from 0 to 300 and is used by young children and some older patients. For the purpose of peak flow measurements, I need you to highlight 1, 2, 3, 4, and 5. For the care and maintenance, I need you to highlight almost the sentence before the last where it says the peak flow meter should be inspected periodically for damage such as cracks, which can cause an air to leak out of the meter, leading to inaccurate readings. If we go on over to page 494, procedure 12.4, I need you to highlight the principle on number 1, the procedural step number 4A and C, and for page 495, the principle for procedure step 5 and number 13, procedure step. Those need to be highlighted. On page 496 for the home oxygen therapy, highlight where it says when it reaches the tissues, oxygen is taken into the cells where it combines with glucose to produce energy. Highlight the definitions of hypoxemia and hypoxia. If we go on down to the last paragraph before oxygen prescription, highlight this where it says oxygen therapy includes asthma, occupational lung disease, lung cancer, cystic fibrosis, and congestive heart failure. That needs to be highlighted. For the oxygen prescription, you need to highlight where it says clinical signs of hypoxemia include cyanosis, dyspnea, tachycardia, and anxiety. On the other side on that first paragraph, please highlight where it says the prescription must include the amount and duration of supplemental oxygen needed by the patient, which are based on the severity of the patient's condition. In addition, the prescription includes the recommended oxygen delivery system and the administrative device, which are described in the next section. For page 498, under oxygen concentrator, you need to highlight where it says it works by separating oxygen out of the air, concentrating it, and then storing it for use by the patient. For the oxygen administration devices, you need to highlight the nasal cannula, the face mask, highlight for oxygen guidelines, and I need you to highlight number 8 on page 500, and for the safety, highlight number 1, 2, and 3. Okay, in this chapter, because this is also another important chapter, it's a big chapter, so as always, I want you guys to read the whole chapter, but I do want you guys to study let me get to it here. You do need to study the figure 12.1, figure 12.2, 12.3, 12.4, 12.5, 12.7, 12.8, figure 12.10, 12.11. Also, just kind of view over the figure 12.12 and figure 12.13, figure 12.14. And if you look on procedure 12.1, the MA is placing and is about to run a 12-lead 3-channel electrocardiogram. So this gives you a visual on a patient on where the leads go. And then if you look on figure 12.15 on 473, that is what a digital Holter monitor looks like. On figure 12.16, you're actually able to see what the electrodes, the adhesives, what they look like. And then on figure 12.17, this is what, so anytime that I've had a Holter monitor done, I've always had to keep a log. I have to keep a log if I feel anything. If I felt dizzy, if I felt like I was going to faint, I would record the date and time. So when I turned in my Holter monitor with my diary, they can go back, other than of course they look at everything, but they will specifically look at that date and time and to see if there was any activity going on. On procedure 12.2 on 477, how to apply a Holter monitor, that's good to review. And then the procedure 12.3 for the spirometry testing, that is good to study over. Figure 12.22 on page 491, that is what an inhaler looks like if you've never seen one. And then figure 12.23 and 12.24, a manual and digital peak flow meter. And then figure 12.25. And then also study over procedure 12.4 on page 494, measuring peak flow rate. And then also, as always, like I said, make sure that you're reading the whole chapter. Once we get kind of caught up in everything, I do think it's good that you go back and look at all the terminology review on each of the chapters. That's a good study guide to become familiar with some of the medical terminology. All right, guys. Well, that is it for chapter 12. Again, make sure you read it all. If you have any questions, let me know.